Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to this weekend's open clinic. Today's topic is actually going to be based on men. So we're going to talk to men. Most times we talk about women, we talk about fertility, we talk about a couple of things. But this afternoon, we'll talk about men, and we're talking about an important topic. Is there any relationship between frequency of ejaculation and prevention of cancer risk? Specifically, talking about prostate cancer. Can frequent ejaculation in men lead to prevention of prostate cancer? So please, when you come in, make sure you can see me clearly. Make sure you can hear me clearly. If today is the first day of attending my open clinic on weekend is on Saturday, 6 p.m. Nigerian time, 12 p.m. Eastern time, US. So let's get started. First of all, prostate gland is only seen in men. So women do not have prostate gland. The function of the prostate is to release the fluid in which the sperm will be carried. So the prostate fluid is actually the vehicle that the sperm is transported in. So the full component of semen, so semen is what comes out from the penis at the peak of sexual intercourse. Ejaculation is the process of releasing of that semen from the penis during sexual intercourse. Now, the fluid itself is made up of fluid from the prostate. So that seminal fluid, it's made up of the fluid that was produced in the prostate. So the major function of the prostate is to aid the sperm towards making the woman pregnant. Now, for some reasons, some researchers in 2016 conducted kind of a back and forth oral-based feedback research in 2016. So they had about 32,000 men who had history of problems with prostate. So they brought them together and they asked a couple of questions, and they tried to correlate the frequency of their ejaculation to the development of cancer. It was a very big study, but that study alone was not conclusive. So the study was conducted in 2016. So they followed about 32,000 men, and they followed their frequency of ejaculation. And after that study, they concluded in that study alone that a man is expected to at least have 21 ejaculation per month. Now, it's important to understand that this is not conclusive. In medical practice, there are steps before something will become a theory. So one-time study of 32,000 men, it's not enough to conclude that frequency of ejaculation leads to prevention of prostate cancer. Now, the theory in regards to frequency of ejaculation and prevention of prostate cancer is the fact that over time, when the prostate fluid accumulates in the prostate, in the body, without coming out, that prostate fluid can become carcinogenic. So carcinogenic are cancer-causing substance. So this is the thinking behind the conclusion from this study. But guess what? One study is not enough to conclude for the whole population of men. 32,000 men is not representative enough for the whole population of men. So we cannot say for sure, we cannot conclude that the reason why those men didn't develop cancer is because they were ejaculating frequently. So there is no evidence-backed, concrete body of facts that supports that theory that when you ejaculate more, you prevent yourself from developing cancer. Now, this is what we have to understand about cancer. Cancer simply means abnormal cells. Now, there are so many other factors that could have played a role in this 32,000 men. It's possible that men that were ejaculating frequently also had healthy lifestyle. So your lifestyle can predispose you to developing cancer or can predispose you from preventing cancer. So if these men that we find a correlation in this study alone, if they were eating fruits and vegetables, if they were not drinking alcohol, if they were exercising, if they had a very good body weight, it's possible that all these things together with making love or ejaculating, remember in this study, it was not specific if the ejaculation is from lovemaking or from masturbation. So a man can ejaculate from lovemaking, or a man can also ejaculate when he's giving himself pleasure, which is called masturbation. So these are two types of process a man can ejaculate. Now, there are different men out there, whatever pattern you use in ejaculating, that's your own privacy. So the bigger spectrum in this study is actually flawed because it was oral history. So what they did is to bring this 32,000 men, then they asked them questions. So they went back. So the study was based on the feedbacks they got from these men. So the suggestion from this study is not enough. So we cannot rely on self-reported answer in medical practice. Remember, the study was done from 1992 once up to 2010. So they followed these 32,000 men from 1992 up to 2010. Now, within this period, for some reason, they all developed cancer. So it's important to understand this. These 32,000 men had prostate cancer. They started following them up from 1992 up to 2010. And the research was based on the feedback. So they followed them up. They asked them, before now, how often do you ejaculate and all that. So from this study, this was where they recommended that 21 times. Now, is it possible that ejaculating 21 times will prevent you from cancer? There is no such study that concluded that. It's not that simple. So there is no specific number of times you need to ejaculate in a day, in a week, in a month. Whichever number you want to go for is based on you. So this is an individual thing, but this is the point I need to make. Every part of the body has a role to play. So your penis has a specific role. The prostate gland has a specific role. There's a particular reason you produce your sperm. Now, the process of producing sperm is not the same thing compared to women. Men produce a lot of sperm in millions. So your sperm is kind of something that will be there until you die. This is not the same thing compared to women. But there is no fact to support the theory of 21 times ejaculation for men. That's not what's going to prevent prostate cancer. Now, there are a couple of factors you need to be conversant with in regards to developing of any cancer. Number one, hereditary. So if your father had cancer of any part of the body, if your mom had cancer, if your sibling had cancer, the possibility you might have a cancer gene in your body is high. Lifestyle. If you have a higher BMI, if you smoke, if you drink alcohol, if you don't exercise, the possibility of you developing cancer is high. Depending on what you eat, depending on what you get exposed to. So there are so many multiple factors that can affect your ability to develop cancer. So even if you are making love frequently, even if you are ejaculating every day, but you smoke, you use alcohol, you have a family history of cancer, you will still develop cancer. Now, cancer is individualized. There are some people that might have all the risk factors in the world, they will not develop cancer. And unfortunately, there are some people that will not have any risk factors and they will develop cancer. So we've seen men that smoked into their 90s and they died peacefully. They didn't have any medical problem. They didn't develop hypertension. They didn't develop diabetes. Then we have seen men that lived healthy, did everything right, but they had early cancer. So that's cancer for you. Cancer can affect anybody. But when you are conscious of the kind of lifestyle, of the kind of food you eat, like men, we are generally advised to eat more fruits and vegetables. So when you eat your fruits and vegetables, you are increasing the level of antioxidants. Oxidants are things that will damage your body and predispose you to developing cancer. There is no one thing that will lead to cancer directly. Most times, development of cancer is a combination of so many factors. Your lifestyle, your hereditary, and the things you get exposed to in the world. There are so many things we get exposed to every single day. So there is no evidence to support the claim that when you ejaculate more, you develop cancer less. There is no such evidence as of today. So what I will advise you to do is to keep on living healthy. The evidence in regards to frequency of ejaculation is inconclusive. We cannot use that snapshot of that study to conclude that if you ejaculate more, you will reduce your cancer risk. Now we need to research more on this. So we need more men. 32,000 men is not representative enough to the millions of men we have in the world. We need more studies. We cannot rely on a single data. Now, the ability of these men to remember the number of times they ejaculated is also not perfect. Some of them might forget, some of them might remember more, some of them might remember less. So it's not reliable. And unfortunately, so many men might not be truthful. So they might not be honest. They will not give us the right answer. So we cannot rely on just a self-reported data in regards to the number of men they used in the past to say, oh, if you ejaculate more, you will have less cancer risk. That's not how it works. So this is a very big limitation to this study. Now, having said that, is there any possibility that ejaculation is going to make your life more healthy? Do we have any health benefits of ejaculation? This is something we need to think about. Now, this is something based on how people feel subsequent to ejaculation. Now, are there other benefits attached to this? Not directly, but in regards to arousal, we discovered that arousal is actually linked to elevation in two hormones, oxytocin and dopamine. So when men see the women they want to make love to, they increase the level of oxytocin and dopamine. These are two important hormones that will help you to be in that zone of making love. Oxytocin is associated with positive mood, positive emotions, comfort, intimate environment. So when your oxytocin level is high in women, your womb will begin to contract. So you begin to have that sexual feeling that you've actually arrived. This is the feeling you have when you have ejaculation. Now, in the same vein, when you are also at that stage of desiring your partner, your dopamine level will also be increased. Your dopamine level is also associated with positive emotions. So when you have a combination of increase in your oxytocin and your dopamine, you will feel good. So lovemaking generally will release another hormone we call the endorphins. Endorphins are feel-good hormones. So the general effect of ejaculation in men are evidence-based. Number one, it will help some of them to sleep better. So if you are blaming your partner for dozing or for snoring after sex, it's because of the hormones I mentioned, oxytocin, dopamine, and endorphins. So most men after ejaculation will sleep. So one of the after effects of ejaculation is what? Sleep. So if your partner is having sleep problems, maybe one of the ways you guys can address it is to make love frequently. And there are so many buy-in effects of lovemaking. Lovemaking on its own is an exercise. Now the problem is, we don't know if this ejaculation is from lovemaking or from masturbation. We don't have that data. Now also, we discovered that men that ejaculate can also have more probability of having good sperm quality. Simply by the fact of when there's a buildup of sperm, when you remove the old sperm, the new sperm will come in. So improvement in your sperm quality is also one of the things we've noticed from ejaculation. Now, in some men, it can also boost your immune system. In some men that have migraine headaches and stress-related issues, when you sleep, the headache is going to be reduced. So ejaculation can improve your sleep. Ejaculation can improve sperm quality. Ejaculation can boost your immune system. And ejaculation can reduce the risk of having migraine headache. And in some men, if they have risk factor from death, from heart disease, when they ejaculate, they can reduce their heart disease risk. So you can see, in reality, there are so many effects from ejaculating. So my take-home advice is this. As a man, you don't have anything that should stop you from ejaculating, especially if you're getting old. When you're younger, you will discover that your libido is high. You discover your physical energy is high. As you get older, as you develop chronic health conditions, diabetes, hypertension, heart disease, everything all over, increase in your body weight, you begin to lose interest in sex. When you begin to lose interest in stress, you're going to increase your stress level. You're going to increase your anxiety level. You might likely be depressed. And if you have other challenges, assuming you don't have a baby, it's going to be an additional stress to you. So I encourage you to keep on prioritizing your sexual health. As a man, increase your fruits and your vegetable intake. Avoid excessive consumption of alcohol. Do not smoke. Exercise. Sleep is huge. There are so many men that have artificial psychological problems with the function of the penis because they are not sleeping, because the level of stress in your body is high. You might be rich, you might be handsome, you might be tall, you might have all the cars in the world. Once you lose your sexual ability, you are a goner. Nothing will bring you back home. You can have all the money in the world, you can use all the Viagra in the world, you can use all the Cialis in the world. Once you lose your sexual function, you're in trouble. So the more you engage in healthy lifestyle, the more you're gonna boost your natural ability to engage in lovemaking and derive the positive impact of lovemaking. Okay? So I'm gonna give us an opportunity to ask questions right now. So in next 15 minutes, I'm gonna sit back and I'll provide you feedbacks to your questions. So please go ahead and ask your questions in real time. Once you come in, start asking your questions. The clinic is open now for questions. The possibility that your partner might dodge this clinic is very high. You see, what we've noticed, most men are too proud. I wouldn't say they are shy, but some of them hide under social media desirability and they don't seek help. If your partner is having erectile dysfunction, if you guys are no longer making love like you used to do, if the penis is having problem, if your partner is having any medical problem, the earlier you drop your pride, the better for you. So it's possible you're watching soccer. You can still watch soccer and you can prioritize your health, okay? So guys, the clinic is open. Go ahead and ask your questions right now and I'll provide you feedbacks. If today is the first day of attending the clinic, make sure you subscribe. So click on the notification button, make sure you subscribe. And once you subscribe, every Tuesday, 1 a.m. Nigerian time, 7 p.m. Eastern time, you will see me. I will pick a topic. I will talk about it. I will give you feedbacks on your questions. Then on Saturdays, I come early. I come by 6 p.m. Nigerian time, 12 p.m. Eastern time. So but right now, let's take care of your questions. Thank you, Doc, for the teaching. Please, are there symptoms to detect early prostate problems? Yes. Now, when you're getting old, about age 40, virtually all men will have increase in the prostate gland. Now, because your bladder and other structures that will help you to procreate is situated about that neighborhood of the prostate. When your prostate is increasing, that process of increase is called hypertrophy. And that medical terminology is called benign prostatic hypertrophy. So your prostate will increase. When your prostate is increasing, it's going to impinge on those structures there. So most men, as you're getting older, it's important to go for wellness check. It's important to establish relationship with a urologist. So by default, as you're getting older as a man, your prostate is going to increase. Now, for some men, we can give them some drugs to prevent the effect of the enlargement of the prostate. Now, for some other men, we might need to remove the prostate completely. Now, there are some criteria we normally check for men. We do what we call PSA, prostatic specific antigen. It's a type of test we use in checking the level of PSA. Unfortunately, for men that will develop cancer, their PSA level will go up very, very high. So there's a difference between increase in your prostate, and there is a difference between development of cancer. So BPH and prostate cancer are not the same. They are entirely two different entities. But as every man is getting old, when you get to 40, your prostate is going to be enlarged. So some men might have difficulty in passing urine. Some men might find it difficult. Some men might feel they haven't really fully emptied their bladder. So there are so many symptoms you might have. We call it BOO, bladder outlet obstruction. So I'm not going to go into the academics. But yes, as you get to 40, make it a point of duty every single year to see your doctor. Very, very important. Okay, let's continue, guys. What age of males has more risk of prostate cancer? Actually, from statistics, when we were growing up, we used to think that cancer is related to elderly people. Unfortunately, the age range is now getting closer to 40. Previously from 50, that's when we start worrying. But prostate cancer is now tilting towards 40. So my general advice, once you get to 40, start living healthy. Start doing the right things. Increase your fluid intake, increase your increase your fruits and vegetables. Drink more water if you can, which I believe you can. Reduce your alcohol or stop completely. Definitely don't smoke. Then make it a point of duty to see a urologist. You cannot avoid seeing a urologist. Some men might have cancer, they wouldn't even know. The cancer might be in their body, spreading, going through the process we call metastasis. So when you have metastasis, it means you had cancer in one part of the body, but from that part of the body, it has spread to other parts of the body. You do not want to be in this position. Cancer can be completely dealt with if we discover it on time. The problem with cancer, by the time we accept we have cancer, is already late. It's already gone through your body and it will kill you. Depending on your culture, depending on your religion, some people don't even believe in cancer. Some people believe in praying it away. Anybody can develop cancer. So the key word in cancer prevention and having a good outcome in cancer is what? Time of detection, time of diagnosis. So for every man in this unit today, especially if you have a family history of cancer, so if your daddy died of any cancer, if your mommy died of any cancer, if your uncle died of any cancer whatsoever, if you have a sibling that had cancer, you have a cancer risk. The same thing is applicable to women. Breast cancer and cervical cancer, to an extent, we can prevent them. So when you go for your well woman check, when you go for your pap smear, when we go for a mammogram, when we check your breast, we are trying to prevent things that can happen if we don't do something right. So the key word, it's lifestyle modification and prioritizing your health. As I'm talking to you, today is the 11th. There are so many men that have piled up a lot of money. They have bought a lot of alcohol. They have bought a lot of food. They have bought cars, but they haven't seen a doctor in 2021. It doesn't make sense. You are simply not prioritizing your health. So prioritize your health as a man. So from age 40, please start being on the lookout for cancer, especially prostate cancer. What's the function of the prostate? I've already mentioned that the prostate produces prostatic fluid, which is the medium that carries the sperm. So the major function of the prostate is providing that prostatic seminal fluid, which the sperm will be in, swim in, so that when you ejaculate, the sperm can go through there to enter the vagina. So that's the major function of the prostate. Okay? All right. Does a change, reduction in quantity of ejaculate signify possible problems with fertility? So not necessarily. But here's the deal. If previously you notice you have copious emission, copious ejaculate, then suddenly it's grossly reduced, we need to know why. Now, because in seminal fluid analysis, we don't go by size, we go for micro-analysis. So some men can ejaculate tiny piece of semen. Then inside that tiny piece of semen, they have quality eggs, good motility, good morphology. Now, some men can ejaculate a bucket of sperm and is completely exospermic. So not necessarily the quantity, but if you notice drastic reduction, that like that, there are some men that can make love to their partner without ejaculating at all. That's not right. So don't focus on the quantity. Let's focus on the quality. So every man going through infertility, you are advised to go for SFA, seminal fluid analysis. When you go for SFA, we are looking at three things. Number one, sperm count. Now, I know so many men will be freaking out whenever we tell them they have low sperm count. Low sperm count is called oligospermia. Guess what? Even with your low sperm count, you can get your partner pregnant. The criteria for getting a woman pregnant is not necessarily the count. It's more about the motility and the morphology. How many of those sperm can move forward? How many of them is good looking? If you have more sperm that can move forward, it means when the sperm deposits in the vagina, it will go through the cervix, it will get to the womb, then it will begin to find its way to the tubes. Once the sperm can get to the tubes, then that sperm has a chance. Remember that sperm can be produced in millions. So the key word in pregnancy is to make sure your man has adequate quantity of forward-looking moving sperm and good-looking sperm. Very important. So if you guys are having infertility problems today, your partner is not able to get you pregnant, it's not just only a woman problem. The problem can be coming from your partner. So don't just focus on yourself. Make sure that your partner also goes for seminal fluid analysis. Very, very important. Okay? Just like women are taught to self-examine for lumps in the breast, are there ways men can self-examine for prostate? Now, this is a very smart question from my moderator, Chinyere. So here's the deal. Because the prostate is actually located on the inside of the male reproductive system, as against the breast. The breast is outside, okay? Now, what you have to do as a man is to be on the lookout for symptoms, bladder outlet symptoms. So if you notice you're now having difficulty passing urine, or you're passing out blood, or you have a swelling in your groin area, or you just went to pee and you notice that you didn't really empty your bladder completely, then we begin to investigate. The only way to check the prostate is to do what we call DRE, digital rectal examination. Unfortunately, it's a very uncomfortable exam because we have to use our finger, pass it through your anus. So we put some, lubricants, KY jelly, put it in our finger. Then we ask the man to be in a particular position. Then we use our finger and we insert our finger into the anus and check the prostate. Now we can also do some radiological tests, X-ray, ultrasound, MRI, and all what. So it's not the same thing compared to women. We normally teach women to know how to examine their breast using the wall clock, the 4 quadrants, 12, 6, 9, 3. Examine on different quadrants, examine your armpits, so that if you notice anything that is not normal, if you notice a lump, you report to your doctor on time. So for the men, you don't have that liberty. But here's the deal. As a man, be conversant with your penis. Be conversant with your scrotum. Be conversant with the whole system. Let me see. So as a man, you have to understand this properly. Let me see if I can. Okay. You have to understand this properly. You have to pay attention. Now, even as a mother, even as a father, you have to pay attention to your sons and your daughters. There are some baby boys that will be born and the testicles are hijacked somewhere in the abdominal area. The reason is because the development of the testes starts from the abdomen, then it will descend. So in these boys, for some reason, they have what we call undescended testes. So if you're bathing your boy, examine the scrotum. The scrotum is the sac, okay? Examine it. Make sure that the 2 balls are there. If for some reason you didn't find any ball at all, begin to report to your doctor. The earlier we get that ball, if it's, hijacked up there, the earlier we get it down, the better. Because guess what? If your boy doesn't have balls, he's not going to be a father. So you see, whenever we talk about the male reproductive system, the female reproductive system, people go crazy. People laugh about it. People trivialize it. But these are the things that will determine if your boy is going to be a father. These are the things that will determine if your girl is going to be a mother. There are so many abnormalities. So even as a man, if you are conversant with your male reproductive system, any changes you see in your penis, some men, their penis is like this. This is not the way the penis is meant to be. This is a sleeping penis. So this penis is limp. This penis is flaccid, is sleeping. This sleeping penis cannot get a woman pregnant. The kind of penis that will get a woman pregnant is erect penis. So this penis is supposed to be up this way. What leads to that? When blood rushes into the penis, it will be ready. It will be erect to make love and lead to ejaculation. Now, if you pay attention to your penis, any changes around the penile area would signify that there is a problem. Any changes you notice in your scrotum, some men will notice increase in their testicles. Some men will notice decrease. If you are having infertility problem and you suddenly notice that one part of your testis is shrinking, there's a problem. It's possible you have hormonal imbalance. It's possible your testosterone is low. It's possible that this might be the reason why you're no longer able to become a father. So we need to be conversant with this, and we need to be conversant with this. Both ways. So get comfortable with knowing your partner's male reproductive system. Stop making love in the dark. Know everything about your male partner's reproductive system. Know everything about your female partner's reproductive system. There are some normals, there are some abnormals, like in women. One part of a breast will be taller than the other, will be fuller than the other, completely okay. You as a woman, pay attention to your body. Stop demonizing it, stop spiritualizing it. Pay attention to the man. If you are having problem as a man, kill your pride. Seek help. The earlier you seek help, the better, because if anything happens to this, your generation is gone. And this is the sperm. A sperm is supposed to have a tail, a middle piece, and a head. So this is basically what you should know about all this. Okay, my time is up. Let me see. Great question from Chinyere. I love that. Doc, is it possible for a man to have breast cancer? 100%. Men can also have breast cancer, just like women can also have breast cancer. The only thing is, factually, scientifically, more women will have breast cancer compared to men because women have more breast tissues. But men can also develop breast cancer. Okay? So breast cancer is not only seen in women. So the answer is yes, men can also develop breast cancer. Unfortunately, the type of breast cancer that men will develop is more deadly. Before you blink, it will kill them. Okay. Thank you for coming. The next YouTube clinic will be on Tuesday. So be on the lookout for another topic on Tuesday. Now, please share this with your partners. I know some of them might be shy. They might be, I don't know. Some of them are just, I don't know how to classify them. But share this with your husband, your boyfriend, your brother, your father. Most men about age 50 will have problems with their prostate. Some, unfortunately, will develop prostate cancer. And unfortunately, depending on the time it's diagnosed, it can kill them. Anytime you have cancer, there are 3 different ways of treating cancer. Number 1, chemotherapy. We give you cancer drugs. Number 2, radiotherapy. We use rays. Number 3, surgery. The time for diagnosing cancer is very important. So if your father, if your brother, if your husband, if your boyfriend, if anybody you know as a man doesn't know about the prostate, share this video with them. This might be the best video I will make for men. So kill your pride. It's possible they finish watching their soccer. Share this video with them. Encourage them to go for their yearly check. The same way we encourage women to go for yearly well-woman check, encourage your men. Some of them are pursuing money. Some of them cannot even use that money for anything because they are no longer performing their role. When they have increased the stress level in their body, they go to drink, they smoke, they eat a lot of nonsense, and they do not exercise. But they can be in front of the TV to watch other men, playing soccer. When you are watching your favorite soccer team, but you are not playing, you're simply just wasting your money. So I encourage you to exercise. There are so many men that their belly is so big that they can't even see the penis. There are so many men that are failing in their civic duty. Your civic duty as a man is to satisfy your woman and make sure you get her pregnant. If you are failing in this department, you're a failure. No amount of money can make it better. Okay? All right, guys. Thank you for coming. And I'll see you guys on Tuesday. Until I see you, remember to subscribe, share this video. Let's make this video go viral. Make this video go viral. Share it with at least your husband, your boyfriend. Encourage them. Look, my people, there is nothing to be shy about. Your penis is the same thing with your finger. Your vagina is the same thing with your finger. If you can take good care of your finger, why can't you take good care of your vagina? Why are we feeling like we committed sin whenever we mention the vagina and the penis? Why? Okay? All right, guys, I'm off now, and I'll see you guys on Tuesday. Thank you for coming. Bye-bye for now.